We are going to get started with some encouraging news tonight. More than 300,000 people worldwide have recovered from COVID-19. That's more than 3 times the number of reported deaths, according to Johns Hopkins University. But then there is the deadly reality here in the tri-state. Both New York and New Jersey saw their daily death tolls spike to new records for the second day in a row. The 2 states combined lost more than 1,000 people in just the last 24 hours. In New Jersey, residents of long-term care facilities account for 10% of all the state's fatalities. That includes 37 veterans who died in a single facility in Paramus.
That's where News 4's Checkey Beckford kicks off tonight's team coverage. Checkey, you're waiting for the Army National Guard to arrive there, correct?
That's right, Natalie. National Guard medics expected here as early as tomorrow. Meanwhile, state health officials say they have plans to move patients from the hardest hit long-term care facilities, but that plan coming a little too late for those who've already lost loved ones. The tragic melody. A young man's salute to veterans at New Jersey Veterans Home. So many of their service members lost to COVID-19.
I hope it will start to get hope that things will get better and that they're not forgotten.
13-year-old Alex Saldana found out, like the rest of us Wednesday, that 37 veterans at the Paramus facility died in recent weeks. The Department of Military and Veteran Affairs confirming 10 of them tested positive for the novel coronavirus that likely contributed to the deaths of 27 others. Dozens more residents are sick, along with staff who have also tested positive. National Guard medics en route to help with the outbreak. Similar heartbreak playing out at long care facilities across the state.
All I have is the videos and the pictures of my last encounter with him.
Denise Perillo feeling the loss of so many other families. Her father, 85-year-old Annabelle Annis, died after contracting COVID-19 at Elizabeth Nursing and Rehabilitation Center. She didn't even know he had the disease. She says the nursing home never notified her. She got the call from the hospital he was taken to a week after developing symptoms.
I'm devastated because no one called me to inform me anything about my dad. I would have driven there, seen him from the window, tell him I love him.
Elizabeth's mayor asking the state's attorney general to launch an investigation into the 22 deaths at that facility since March. 12 of them, including Anna's, confirmed COVID-19 deaths, the rest untested. And the mayor says Perillo is not the only family member who wasn't notified.
I received social media requests today that they didn't even find out that there were COVID-19 cases into the facility because no one there informed the residents' family.
And we have reached out repeatedly to that nursing home since yesterday, but have not received a response. We're live in Paramus this evening. Checkey Beckford, News 4 New York.
All right, Checkey, thank you very much for the update there. Across the United States, coronavirus deaths total more than 14,000. New York State now accounts for nearly half. But today, Governor Cuomo balanced that bad news with the good, that admission rates in the state's overloaded hospitals are actually seeing a significant drop. We're talking an average of just over 500 new COVID-19 patients a day. Compare that to more than 1,200 last week. News 4's Villeda continues our team coverage tonight with the progress now in the fight against the pandemic.
The last 24 hours have been deadlier than before. These makeshift morgues are common sight outside of hospitals all across the city. But while the number of deaths is rising, there is hope New York City may be turning a corner. In New York City, a show of appreciation on the streets and a show of support arriving from the West Coast. Ventilators shipped from Oregon and California arriving here. A show of humanity when it's needed the most. 779 people died in New York in the last 24 hours. It's the deadliest day of the pandemic again.
Every number is a face.
Despite the grim statistic, hope. The governor believes the cases in New York may be plateauing. The number of hospitalizations is down.
The 3-day average trend is also down. Anecdotally, the individual hospitals, the larger systems are reporting that some of them are actually releasing more people than are coming in.
Still, to keep up with the cases, another field hospital will soon start taking patients. These are new pictures from the Billie Jean King Center. It houses hundreds of beds, a stone's throw away from hard-hit Elmhurst Hospital. The calls for help are still coming in. Paramedics seeing multiple family members sick under the same roof.
Half, 50%, 80% of the household is exhibiting symptoms of COVID-19.
Now, as state and local leaders look at the number of victims, a trend emerging. Here in the city, the Black and Latino communities make up 62% of COVID cases.
Let's actually get research and data. Why do they have higher rates of infection?
Research to be done while the work to save lives continues inside city hospitals. Hospitals, which the mayor says have enough ventilators to last the week. Military help arriving too. This was at Lincoln Hospital in the Bronx, a united effort to beat a vicious virus.
New York is nowhere near out of the woods. The mayor and governor say it's even more important now to keep social distance, to keep that downward trend going. The statewide pause in effect until April 29th. Reporting from the west side, I'm Villeda, News 4 New York.
We're going to turn our attention now to Connecticut, where the total number of coronavirus cases has now risen to more than 8,700. 335 people have died. Fairfield County remaining the hardest hit area, nearly 4,500 cases in the county.